The age limits, which used to say 18, now are 16. Now you're seeing people starting cross-sex hormones at 15 or 14. And so when you move on to cross-sex hormones, you're now initiating medical therapy where some of the changes that are going to take place are permanent. And that's a whole other ball of wax, I think, for some of these families, and that can be really hard. So when we think about medications, if we're going to go the route of medications, there's two kinds. One are medications that sort of block progression through puberty. The other medicines that you could use would be right to going to sort of what we call cross-sex hormones, or in this case, it would be sort of testosterone. So testosterone as a medication has been around, obviously, for a long time. The way we would consider using it here, sort of for in a cross-sex sort of way, there aren't a tremendous amount of studies that have been done to document all the potential side effects and the risks and benefits. Some of the changes, again, are permanent and some sort of aren't. And I think those are the things that kind of freak people out. But you think of things like, hair loss of the temples, facial hair growth, deepening of the voice, all things that go along with sort of a male sort of hormone. You're gonna have increased muscle development. So some of it's gonna be things that he'll, want. But some of them, the things that you want to look out for are things like acne, mood changes, and then all the risk factors that go along with a typical male predisposition. So things like heart disease, stroke, those kind of things. Males are more likely to have heart disease than females. Males are more. We're asking families to take some leaps of faith based upon the child that they have in front of them and really what we don't know with regard to some of the long-term consequences of these medications. I mean, if you look at our consent forms, they're fraught with vague language and may, could. We know very little about things that are really important to families, like fertility, like cancer potential or oncologic potential of these agents, cardiac risk. I mean, things that are families want to know when they're making decisions about their children. I mean, there definitely is the potential for the testosterone or the cross-sex hormones to prevent sort of normal, what do we call normal fertility to sort of occur. Have you ever thought about having kids yourself? We're sort of asking you to be really grown up really quickly, when you make these decisions, and that's what's tough. But I want you to really think through some of the stuff we're talking about here. Does that make sense?
I don't really know. I would like to have kids, maybe someday, but.
I don't envy these parents. I mean, I think they're making decisions in a very difficult environment. I mean, I know that we do informed consent, but really, I mean, how realistic is it to believe that a 14 or 15-year-old or 16-year-old has really the capacity to make that kind of decision for him or herself